I wanted to review your most recent laboratory studies. The anti-nuclear antibody was positive. This is a test for lupus. It looks for antibodies to proteins found in the cell nucleus. The nucleus is essentially the brain center of any cell of the body. Many different types of proteins are found in the nucleus, and they can all be targets for an immune attack. The ANA is a test to see if there are antibodies in the blood that are attacking any proteins that are found in the nucleus. The ANA is a screening test for autoimmune diseases, includes rheumatic and non-rheumatic disease. The ANA is not specific to a single disease. A strongly positive ANA test makes it more likely that a person has an autoimmune disease. However, it does not distinguish between different types of autoimmune diseases. If the ANA is positive, there are clinical features of an autoimmune disease. Other more specific tests will be usually ordered. After the blood is drawn, it is sent to a lab where it is diluted with saline solution and tested for the presence of antinuclear antibodies. The rheumatoid factor was negative. This is a test that measures the amount of rheumatoid factor in your blood. Rheumatoid factors are proteins produced by your immune system that can attack healthy tissue in your body. It is a blood test that looks for antibodies called rheumatoid factors. These are autoantibodies that are produced by the immune system that can attack a variety of healthy tissues. It is usually ordered when a person is suspected of having rheumatoid arthritis or other rheumatic diseases. The test is not very specific. In the early stages of RA, about half of people will have a positive rheumatoid factor and the other half will have a negative rheumatoid factor. So having a negative rheumatoid factor does not necessarily rule out a diagnosis of RA. In established, meaning definitely diagnosed for RA, 70 to 80% of people will have a positive rheumatoid factor test. Once the test is positive, it rarely becomes negative. Since not everyone with RA will test positive, doctors interpret the results in the context of a person's other signs and symptoms, as well as the results of other tests. The anti-CCP antibody was negative. This is an antibody present in most rheumatoid arthritis patients. Levels of this antibody can be detected in a patient through a simple blood test. Positive anti-CCP can be used in conjunction with other blood tests and imaging tests. It is a blood test that looks for anti-CCP antibodies, also called anti-citrulline protein antibodies, or ACPAs. These are a type of autoantibody, an antibody produced by the immune system that targets something that the body's own tissues are made of. ACPAs target a type of protein called citrulated protein that can be found in some people's joints. The anti-CCP antibody can be helpful in diagnosing rheumatoid arthritis. ACPAs are present in 60-70% of people who get RA. Since not everyone with RA will test positive, doctors interpret the results of this test in context with their patient's symptoms and the results of other tests. The SSA and SSB antibodies for Sjogren's were negative. These antibodies can be found in Sjogren's syndrome. Sjogren's syndrome is a condition characterized by dry eyes and dry mouth. At times, Sjogren's syndrome has been associated with joint aches. These are 70% of patients with Sjogren's are positive for SSA and 40% are positive for SSB, although this test can also be found in lupus. The ANA, in this case, was positive and can be found in lupus. Lupus was with a negative index, which is less supportive of lupus, but the diagnosis of lupus also depends on additional clinical criteria. And that would include hair loss, mouth ulcers, skin rashes, sensitivity to sun, joint swelling, joint pain, stiffness, ankle swelling, shortness of breath, chest pain, skin thickening, or bruising. These symptoms may indicate the possible development and exacerbation of lupus or an autoimmune disease and would require further. Now, lupus is a chronic autoimmune disease that causes inflammation throughout your body. An autoimmune disease is a condition in which your own body's immune system is responsible for inflammation breakdown of cells. It can affect various organs in the body, including the joints, skin, heart, blood, lung, brain, and kidneys. Symptoms of lupus include fever, fatigue, body ache, joint aches, rashes, skin lesions, shortness of breath, dry eyes, chest pain, headaches, confusion, memory loss, and and possibly kidney problems known as nephritis, which is inflammation of the kidney. There is not a specific blood test or imaging used to diagnose lupus. Instead, we consider a person's signs and symptoms and rule out other potential conditions. In addition to taking a medical history and physical examination, we would have to consider laboratory tests, imaging, including chest x-ray and echocardiograms, tissue biopsy. At times, a kidney biopsy is needed if warranted. Often the doctor will say that lupus might be present, but that the current symptoms are insufficient to signify a firm diagnosis. In this event, the physician will likely monitor the patient's symptoms, signs, and lab tests closely over time and have patients return for visits. As I mentioned, no single finding qualifies an individual as having lupus or systemic lupus erythematosus. Instead, the American College of Rheumatology has devised certain classification, and 4 more of these criteria must be present for a classification of lupus. The term classification is not synonymous with diagnosis. It means that a reasonable certainty exists for the diagnosis of lupus for research purposes. But these criteria are currently being updated and believed to be about 90% effective. The criteria include malar rash, which is a rash on the cheeks, discoid, which is a crusty lesions, problems with the sun or photosensitivity, oral mouth or nasal ulcers, arthritis of the joints, kidney disease, neurological conditions such as seizures and psychosis, and blood disorders. There is also an additional criteria formulated by the Systemic Lupus Erythematosus International Collaborating Clinics, which is an international group of rheumatologists and immunologists with special interest in lupus, also created a criteria for lupus classification, which is shown on the next slide. As with the American College of Rheumatology, at least 4 criteria need to be fulfilled for the classification of SLE or lupus. Please look at this slide and notice that there has to be 4 of the criteria, at least 1 clinical, 1 laboratory, or there's a biopsy-proven lupus nephritis with a positive ANA or anti-DNA. I should add that the anti-DNA, anti-SM, antiphospholipid antibodies, low complement levels, and direct CUMs are all additional lab tests that we pursue to evaluate this. Hemolytic anemia also refers to an anemia due to the destruction of red blood cells. Leukopenia means low white count or low white blood cell count, and thrombocytopenia is another blood test which refers to platelet counts which occur in clotting. Serositis also is another criteria which pertains to inflammation of the lungs or heart, and non-scarring alopecia refers to loss of hair. Thank you.